on the station that's on your side. This is Channel 7 News Daybreak.
Hey, welcome back, everybody. Coronary artery disease is a process that starts when we're adolescents and then progresses throughout our life. However, there are certain things you can do to slow this down. Joining us this morning to talk about some of those things is Baptist Health cardiologist Dr. Anthony Fletcher. And Dr. Fletcher, thanks for being here as always. Thanks for stopping by to talk about something that I didn't really know started in our youth and our adolescence.
It certainly does. Unfortunately, statistics from soldiers that have died prematurely and people who've succumb to car accidents show us that arteriosclerotic plaques begin even in adolescent ages. So it starts very early. It's a process that begins really early in life.
So how do we prevent something like this?
Well, essentially, education and knowing your numbers. That's the most important thing. You know, we always talk about the risk factors, diabetes, hypertension, cigarette smoking, inactivity, obesity, and family history. Premature death from heart attacks before the age of 50 puts you at increased risk if that's in your history. So knowing that history is very important. Okay. And then once you know those numbers, very important that we know the numbers of blood pressure, cholesterol, knowing your weight, of course, and sugar levels. Work aggressively to modify those numbers, get those numbers under control. You want that blood pressure ideal 120/80, but at worst 140/90. You want the sugars, in the 100 range. You want the cholesterol controlled, and you want to get that weight down to the ideal weight for your body build. So those are important things.
Okay, what is a coronary calcium score?
Well, coronary calcium score is a way that we can risk stratify an individual's risk, and not for the low-risk person. I mean, if you're healthy and no family history, no risk factors, it's probably not the best test for you. But let's say you have moderate risk factors, you have a little bit of blood pressure, some cholesterol, family history, and you're asymptomatic. You can get a calcium score, and a calcium score is a test that's a non-invasive test. You go to a center that has a CAT scan, and they essentially scan you almost fully dressed, and that scan picks up calcium in the arteries. The normal artery has minimal calcium in it, and that artery essentially is a good artery. But if we pick up progressive levels of calcium in the artery, the higher the level, the more important it is that you may have coronary artery disease that's silent. And that helps us sort of treat you aggressively. You're asymptomatic. We might say, oh, your cholesterol's okay. Oh, your blood pressure's okay. But if your calcium score is elevated, I'd say anything between 100 and 400, the higher the number, the more significant the risk for coronary artery disease. And so we'd be aggressive. Whereas your cholesterol, LDL, the bad cholesterol we've talked about, might be 100. We might be more aggressive with treating you with a statin because we know that statins help us prevent the progression of disease and, more important, the sudden rupture of a subclinical plaque. And then again, exercise. Yeah. After we're sure if you have a high calcium score, you may want to do a stress test first to make sure that you don't have silent disease. That stress test is okay, then we want you to exercise. It's good for your blood pressure, it's good for sugar management, it raises the good cholesterol. And then just being more aggressive in terms of watching the blood pressure, making sure it's well controlled. So the calcium score helps us identify that person that might be at risk for a sudden event. And again, the person that has a higher score, let's say it's 400 or greater, there's about a increased risk chance in the next 3 to 5 years that you're going to have a cardiac event, i.e. a heart attack or unstable angina.
Something you want to prevent. You can do that by calling the Baptist Health line at the number on your screen. Dr. Fletcher, thanks again for coming in this morning, explaining all of this to us.
Well, it's always a pleasure.
So we can understand it.